Welcome to the HealthSpark, Igniting Healthcare Management Change and Evolution. I'm your host, Dr. Raya. Hi, I'm Dr. Raya, and today on the HealthSpark, I have one existing student and some recent alumni that are joining us as we talk about their administrative residency experiences and fellowship experiences. So I want to allow them to introduce themselves to us. So you all please tell us your name, what year you graduated, and why don't you start there. Tell us your name, tell us a little bit about yourself, what year you graduated, maybe tell us about your undergrad, and then we'll pause there. So we'll start with the same order you formally introduced yourself in. So Sydney.
Sure. Hi, my name is Sydney Tischler. I recently graduated from UT Health's Master of Public Health program with a focus in healthcare management this past spring of 2025. And I'm originally from Dallas, Texas, and then I moved to Austin and completed my bachelor's in public health at UT Austin before attending UT Health for my master's.
Thank you, Sydney.
Hi, I'm Britney Gomes. I recently graduated spring of 2025 at UT Health, Master's in Public Health, concentration Healthcare Management. My undergrad is at Baylor University in Waco, Texas, where I did a bachelor's in science in public health. And then also I am from Katy, Texas, so a little bit of outside Houston.
Thank you, Britney.
Hi, everyone. My name is Sofia Tovar. I'm from the Woodlands, Texas, so also from the greater Houston area. I did my undergrad at UT Austin, and then I'm currently a second-year Master of Public Health student at UT Health Houston's campus with a focus in healthcare management.
All right. So if you all don't already know about the Masters in Public Health with UT Health Houston, we are a CAMI accredited program. And when you are part of a CAMI accredited program, that makes you eligible for administrative residency or fellowship programs. And everybody here on the podcast has participated and done an administrative fellowship or a residency program. So I want to allow everybody to tell us about either their recent experience or the experience they are currently in or about to go to. So same order, Sydney, tell us about your recent experience and what's happened there.
Yes, so I just recently completed my administrative fellowship at Baylor Scott White Health, and I was an administrative fellow for the system at the system level. So I rotated throughout the entirety of the health system at different hospitals, clinics, within our corporate divisions like joint ventures, our provider network that employs all of our physicians, and within our ACO for the system as well. So I got a taste of a little bit of everything, and that process started last August, ended this past June, and yeah, I rotated throughout there. I would spend anywhere from 2 weeks to a month at a different facility or within a sector of the healthcare system. And I had a preceptor who was kind of my guide light throughout the whole thing, helped set up things, get me connected to people in the system, and worked on various projects, a lot of shadowing and learning, and that's how I ended up where I am now.
Hey, great. Thanks for that overview. Brittany.
Yes, so I'm an incoming fellow for Sutter Health, which is in the Northern Market, California, and I got placed in the East Bay Division. I first got accepted this fellowship back in October of 2024, and my fellowship actually starts July 21st. Is my first work day, and it's a one-year fellowship opportunity. And with this fellowship, it is very flexible. So this is really tailored towards the individual and what they want and what they're looking to see their future career progress. For me, it was population health, ambulatory sector, patient experience, and that's how they paired me with my preceptor and also the market that I'll be in, which is the East Bay Division. I'm just excited about this opportunity and to learn what, Sutter Health has to offer. And a lot of people within this fellowship, they do stay and, they continue their journey with the organization.
Yes, and so since I'm still doing my MPH, so I'm doing my administrative residency or internship. They're pretty synonymous, but I'm doing mine with the University of Utah Health. I interviewed and was offered this position in November, and it was very unique because whenever I got the phone call and they were telling me that I would be interviewing with revenue cycle and decision support, I was like, okay, I'm going to have to go into this having to decide which one I want to do. But no, they were offering me both. And so then that was just a great opportunity to be exposed to both healthcare finance and analytics. And so I moved May 12th was my first day. I've been in Salt Lake City since. And so Monday, Wednesday, and Friday, I work for Revenue Cycle, and I've been helping them with their business continuity plans. Just in the case of an emergency or disaster, how can Revenue Cycle keep their operations functioning? So it's been a great crash course and overview into Revenue Cycle and billing. And it's been very interesting because I'm taking accounting right now. And so when we spoke about the revenue cycle part and then also being like, I know about this entire process. So that's been great. And also in undergrad, I was involved in research and I did some data analysis. And so now that I'm with decision support on Tuesdays and Thursdays, I've been helping them with their data governance program and getting just more materials out there because as we progress, a lot of institutions are data driven institutions. And so there needs to be certain frameworks and policies to protect and how that data is used and who gets access to that data. But then I've also been able to do other reports that the analysts do within the department, and they're total data scientist wizards. So I've been able to develop a lot of skills in data visualization, which I think is really important nowadays. That institutions make data-driven decisions and see what the data says to be able to make a better decision. So towards the end, our final presentation is on July 29th, and it's just been a great experience.
So this is tied to my third question about how did you all secure these opportunities? And my logic in asking you all this question is because I think when people hear the podcast, they're going to be wondering like, oh, well, you all probably already had all this healthcare experience. Like, and now I'm thinking, Sydney, back to, when we were talking about interviewing and even, Brittany and people are going to be thinking like, oh, well, they probably already had all this healthcare experience and they probably already had like all these jobs in healthcare. And so when you answer the third question, I want you to tell us like, were you all already healthcare executives? Were you all already like seasoned healthcare professionals? So tell us first about, what kind of healthcare ops experience you had, and then how did you secure this opportunity? So same order, Sydney.
Yes, so prior to my administrative fellowship, I had no operational, administrative, financial experience of any kind. This was really a stretch for me. All of my experience before this had been clinical, and I did hospital volunteering, I was a medical assistant, but this was a big jump for me, and it wasn't something I really planned on doing really early on in my college career. And yeah, I entered without any experience, and I was really nervous about it. I thought, oh, a lot of these people are going to know so much more than me. They already know, they're so well connected within the industry. And I thought that put me at a disadvantage as an applicant and as an interviewee, but it proved to not. I ended up obtaining a fellowship of some sort and got a lot of great experience and left and got the same experience and knowledge as people who I might have thought at one point had a lot more experience and a higher chance of being in my position than I did at the time.
Mhm.
So, yes, before my fellowship, I had no experience. This was my first taste of true operation, strategy, business development outside of the classroom.
Right. So how did you secure this then?
Yes, so I had a connection and I reached out to so many different people. This wasn't the only place that I applied to or interviewed at. And there were a few different places I would meet somebody, I'd be connected through a friend or a family member and just really shot my shot. You never know until you know, and reached out to a lot of different places, cold emailed, would find online applications, ones that were sent programs that were sending out a wider net of applicants. And so really would do that and try to meet with people who were involved. And even at places I interviewed and didn't get the fellowship at, I got the chance to meet with either their current fellows or then go on to meet with other people that I interviewed with. And just built those connections further to have that network moving forward. But yeah, had some connections, reached out and just was myself and really tried to show my interest and where I was coming from and wanted to get to know them and their program better. And it worked out in the end.
Was your network?
Yes, it was my network for sure.
And are you a part of any professional associations?
I wasn't before my fellowship, but during my fellowship, I became a student member of ACHE. And so this past year, attended the national conference with some other people within Baylor Scott White and different leadership and other fellows there. So not until then. So it
Excellent.
was still possible without being in that network.
Brittany.
Yes. So, like Sydney, I had little to no health ops and admin experience in my work. A lot of my previous work experience came from research. I was a research assistant at UT Health. I did my practicum in a research position. And then in January of 2024, I got a full-time position as a clinical research coordinator for Texas Children's. And so I was working full time and then also doing part time grad school, and then was also doing the fellowship applications. And for me, that's where I feel like I stood out and I was able to pull from my full time work experience. I worked in a department, I was in a hospital setting, I worked with a team of physicians, nurses, chaplain, I saw their day to day. And so I took the operations of our department and I was able to see, well, if this is what our department's doing, this is probably what's happening globally in other departments. And so that's how I was able to get those transferable skills. I worked on research projects. And so, that's transferable PM skills. And so all of this, I was able to talk about in my interview process, how to be a good communicator, how to handle conflict, how to work with others, how to take the lead on projects, how to speak up and say your thoughts in a respectful manner. I was able to pull all of that from my clinical research position. And I think that's what helped me stood out is I was able to manage a full-time job and still be in grad school and still go through all of this. I think interviewers saw that I was able to handle my time management. I could work with others. They saw my work ethic in that. And I think that was just unique in my journey. So
Excellent. Okay, great. Go ahead, Sophia.
And so likewise, I was not a healthcare executive or professional at all. So in undergrad, I was actually pre-med and up until not that long ago, actually. So I had catered my entire professional experience for medical school. And so I had patient care experience and research, but nothing in healthcare operations or any kind of business experience aside from our healthcare quality improvement project, which that was great. And something that I guess a little misconception is that sometimes when you go from pre-med and switch or kind of pivot to administration or to something else, you think that, or you're so far, but you're behind because you don't have these business skills, but there's actually a lot of transferable skills. And so whenever I got paired with that opportunity for the University of Utah Health, and so I just make sure to speak to my transferable skills. So one thing that they really liked was patient care, that I had been in a patient room and I had about 3 years of patient care experience, both outpatient, one with an allergist for about 2.5 years, and then 7 months with internal medicine. So I think just being in the patient room and also being with the physician and seeing their day to day, that gives you a lot of insight and also just the ability to learn very fast. And then I also worked as a research assistant for one of the physicians. And so that was a great exposure into being able to use my data analysis skills. I was also a research coordinator for Baylor College of Medicine for a pediatric nutrition lab called Papás Saludables, Niños Saludables. And so I think those experiences when you're working with patients, it teaches you how to interact with people, to have emotional intelligence, to be able to connect with one another. And I think that's what they saw. I think also just during the interview process, they saw my eagerness to learn, wanted to leave the Texas Medical Center, learn from a different health system. And so then that night they ended up calling me and giving me the offer. So I think it's a little bit of luck as well. But no, I didn't have any connection to the University of Utah. I applied and yeah.
Okay, wonderful. So before we started recording, I mentioned to you all that I know many students, well, I shouldn't say many, but I know a handful of students who tried to secure administrative fellowships or residencies, and they aren't successful, or they haven't been successful so far. So what do you think that you all did differently? And I think I've heard some of your answers already, but or what advice would you give to students to help them that maybe aren't done with school yet, to kind of, they still have a chance to secure some opportunities. So what do you think you would say to them? Same word.
Yes, I think my three biggest takeaways, having been somebody really wanting an administrative fellowship and knowing that I didn't have an immediate shoe-in, or that I was going through the big process and getting rejections and not really sure what to do, to somebody who was in one and now out of a fellowship doing a full-time job, is you have to be so true to yourself and do things for the right reasons. You don't want to get involved in things and do things to check a box and say, a lot of other students do this, I should also do this because this will set me, this is what is required. Do things that are of interest to you and that you find value in, that can speak to your personal mission, to why you want to do what it is you want to do. And it'll make you a better applicant, it'll make you stand out, and it'll make your story to your position cohesive and believable and people can relate to. The other thing I would suggest is to have as much of an open mind as you can going into something. You don't want to enter a fellowship or a role with the goal of, I'm specifically going to become this position in X number of years. And so you don't want to give the impression that you're only going to want to get involved in certain projects, you're only going to want to speak to certain people. You want to be interested in everything, and that'll help enhance your experience as well and make people more excited to work with you if you're just open-minded, happy to be there, ready to learn from whoever, asking questions as much as you can, because during that time, like, this is the only opportunity you have to be at the same level of some really high level executives and to be shoulder to shoulder with these people. And so just being yourself and authentic to what you want to do, open-minded and asking questions. And along with that, my third piece of advice would be to say yes to everything. Say yes to whatever it is they give you. Say yes to any meeting they invite you to, any random late night meeting that seems inconvenient and is 45 minutes away. Say yes and go, because you never know what can happen. And I met so many great people by doing that before my fellowship, during and after. And just letting yourself be uncomfortable, say yes, go do it, be open-minded and be yourself. And you're going to be successful in the end, and you're going to end up where you're supposed to be by doing those things for sure.
I love that. Thank you so much, Sydney. Brittany.
Yes, I would echo a similar sentiment of just, be comfortable being uncomfortable. And I remember like listening to a fellowship panel and having that same advice said. And it's truly, I would just be okay not being comfortable, and you have to put yourself out there. And that means with networking, going to mixers, if you know an administrative fellowship is something you want to do and you want to pursue, start early going to, mixers and networking, and have a mentorship program to be a part of. And that was what I did. I knew I wanted to, shoot my shot with this administrative fellowship. And so I joined a mentoring program through NAHSE, National Association Health Service Executives. And from there, I was partnered with the mentor, and he's actually an executive in California and in LA. So when I was applying to these fellowships, I told him, out of all of these fellowships, I'm doing these. Sutter Health is one of them, and Sutter Health is a California market. And he just had a connection. And so, that helps, is when, you have someone who knows something from the inside of a fellowship you're trying to apply for. And you just don't know until you put yourself out there with those opportunities to connect and communicate. And so, just put yourself out there. Don't say no to anything. If you're eager for a fellowship, apply outside of your state too. I know a lot of people, they want to be in your home state. And for me, I did applications in Texas, and I felt like Texas was so competitive that I found my opportunity in California. So if this is something you're really passionate about, you're going to feel uncomfortable moving away from home and out of state. But if you're willing to take that leap, do it.
Amazing. Great. Sophia.
So as someone who's just doing the internship and actually about to start the administrative fellowship process, so Brittany and Sydney, that was great advice. Thank you. And so I can speak more towards the internship. And so advice for the internship, I would echo what Brittany said, cast a wide net and also start early, because a lot of the times I think maybe it comes from undergrad and it just depends on which sector you're looking into. But a lot of healthcare, like either consulting or admin, actually recruits in the fall. And while some institutions do recruit in the spring or like winter. But I think that's something that really worked well for me was starting early and doing my research and looking at, okay, who's offering these administrative internships? Because there's a lot of fellowships, but not everyone offers specifically an administrative internship. So I did that, casted a wide net, applied out of state. And so I would say those would be my biggest advice. Also, when you're interviewing, I guess just acknowledging that you have these sets of skills, but you also have a lot to learn. So I think just being eager to learn and just sincere and that this is where my knowledge gap is, but this is what I can bring. I think that's great when interviewing. And
Mm,
so I would say those would be my biggest for the internship, at least,
yeah,
to apply early, cast a wide net, and then also just know your resume and know yourself and know how your experiences, no matter if you don't think that they apply or that they're directly transferable, they probably do apply in some way. Like Sydney was saying, say yes to everything. There's always something to learn from every experience, and just make sure that you know it well enough and can speak to it in an interview.
great. That was wonderful. Thank you so much for sharing all of
That
this.
reminded me too, when Sophia was talking about starting early, is something that I wish I would have done was to be familiar with the cycle of the different hospitals.
Mhm.
A lot of them will recruit, like she was saying, in the fall or at different times. And I know certain hospitals will have a winter cohort or a summer cohort or a fall cohort or healthcare systems, not just hospitals. So I think becoming familiar with that is helpful because there were times I submitted applications and I was definitely on the tail end because I didn't know soon enough. So if you know what market you want to go into, try to become familiar with their timing of their application cycle because that will help put you at an advantage and when to reach out to people too.
Excellent point. Okay, wonderful.
I would agree. I did an Excel sheet to keep track of everything because it can get crazy
I bet.
managing deadlines.
Same.
All right, wonderful. Okay, so wrapping up. Um, so now that you all have either, well, okay. So what are your thoughts on next steps, at least for Sydney and I don't know, Brittany and Sophia, you let me know what you're thinking, but what's next for you all? What's in the cards or what are you thinking now that you've kind of had some experiences?
Yeah, so for me, after finishing my fellowship, the way that worked in my position and at my institution is within the last few months of your fellowship, you start looking back at the connections you made throughout. So this is also kind of a piece of advice that goes with the last question, is making really good relationships throughout your year is really beneficial to the next steps you want to make after the fellowship. And if you have the desire to stay within the system you completed your fellowship at, this is how that works is you kind of get to the end of it, you finished your formal rotations, and for at my program, the way our fellows kind of work is you then work on projects, get some more actual tactile experience on things, and you start looking for positions and openings. And a lot of that starts by reaching out to the people you shadowed with and the people you rotated at to seeing if they have anything going on. So I did that. I had a few different options, a few different areas of interest, and I ended up working now in our accountable care organization. And I work there as a program manager. And we do a lot of management of geriatric services and Medicare, things of that nature to try to get patients more well connected and better appointment availability, things like that. And that's where I'm at now. We'll see. I just started this position. I'm a month and a half in. So I'm just now getting to the point where I'm comfortable. I can lead a couple of meetings. I understand what's being talked about. So it's still pretty premature for me. But I wanted to end up somewhere that I really enjoyed and I like how close I am to the patient. I have a good understanding and I work with physicians and APPs regularly on how we can make their life easier to make our patients receive better care. And I always loved that aspect of it. And at the same time, I get to use a lot of the network and connections I made throughout my fellowship that are a little disconnected from our ACO as it's kind of its own organization within the whole system. But yes, using all of that moving forward and you can kind of see how things can get connected later on and how maybe some of the initiatives I'm working on aren't launched yet at a hospital I've really enjoyed a rotation at. And I remember during my fellowship that they had a lot of gaps in these areas and maybe what I'm working on now, I can connect with them and we can help make the system across the state better and help serve our patients better. So that's where I'm at. I'm transitioning right now out of the two.
Excellent. So, I mean, Brittany, you're barely getting started, but I think it's exciting for you, especially because, like, I personally know somebody who was in your position and then stayed at Sutter Health. So I think it's exciting for you. I don't know if you have any closing thoughts.
Yes, I'm just super excited to just learn this year. I know at Sutter, they're very big on networking, and I would say that's probably similar with any fellowship. You network, 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 and you put yourself out there because, like Sydney, like they can either open up a role for you or, create one. And so you have to be networking throughout that year because you have to share, oh, I'm interested in ambulatory operations. I'm interested in population health or strategy, and they connect you with the right person. So when you're about near the end of your role, they can already, or end of your fellowship, they can already have something for you. Nothing is just given. You have to be doing that work. And so I'm mentally preparing myself for this fellowship. I'm just excited. I'm eager to learn. And so just looking forward to this opportunity.
Excellent. Congratulations again. Sophia, what are your thoughts now that you're wrapping up your internship?
Yeah, so I mean, I learned so much and I'm excited to come back and to complete my second year, but I'm also excited to start the administrative fellowship application process. I mean, it's a very lengthy process, but I've heard a lot of great advice. I think that is the path for me. I just think I need to continue learning and find my place. I really have a lot of interest in operations, but also finance and analytics. And so just trying to find something that combines everything. But I definitely have a lot to learn. So I think that's the administrative fellowship is the right path for me. But of course, I'll still cast a wide net, apply to other full-time positions within hospitals and healthcare systems. So I'm just really excited to see what the future holds. I'm excited to keep learning, and yeah, I'm excited to graduate in here.
Excellent, excellent. All right. Well, thank you so much again. Is there any other closing thoughts that you have for anyone listening, for anybody who's I think you all have said it beautifully. I think, your point about your networking, the things nobody likes to do, nobody wants to do that, right? Whenever I do LinkedIn labs, whenever I do career coaching, nobody wants to hear that, right? Nobody wants to hear that 80% of jobs are filled through their network, right? Nobody wants to hear that. When you all talk about translatable skill set, I think all of you said that, right? Explaining that you have translatable skill set, but having the ability to communicate that you have a translatable skill set. That was wonderful. Saying things like, you have excellent time management skill. I know you all, I think that's very evident. Being true to yourself. I have another podcast speaker, Joshua Ortiz. His episode will launch shortly, but some of the advice that he always gives is that you have to know yourself, right? You have to know yourself before you can really do anything. And I think, Sydney, you said that beautifully. Being open-minded. You all have all said saying yes to opportunities. How many people are like, nah, I'm not going to do that. No, I don't want to do that, right? Being uncomfortable with, nobody wants to be uncomfortable, right? And you all have put yourself out there. Even just showing up to a podcast, you put yourself out there. Starting early, being prepared, right? That takes a lot. Putting yourself out there, casting a wide net. So I think all of these things are amazing. I really appreciate you all sharing your wisdom, sharing this information with others. And I hope that I hope the people listening, the students listening to you will take your advice and hopefully be able to replicate the success that you all have had. So thank you so much. I'm really excited to see where you all land and how you grow. So let's stay connected.
Thanks for listening to the HealthSpark, Igniting Healthcare Management Change and Evolution. Please look out for future episodes and follow us on our social media pages.